think Arab Health gives us a great opportunity to showcase our brand and showcase many of the things that we do for our patients. We're a brand and we're a healthcare system that's really focused on the quality, the safety, and the experience of care that we deliver. And so being here at Arab Health gives us a chance to interact and see many people throughout the entire region. Yeah, the idea behind the branch in London is a couple things. One is it allows us to continue to extend our model. We're very proud of the success we've had here in the United Arab Emirates in Abu Dhabi with Cleveland Clinic Abu Dhabi. We certainly are proud of what we've done in Ohio, and I think London allows us to complete the aspect of having a globally integrated healthcare system where a patient can see us any of those locations, and we think provides access for the whole world. But in all of those locations, it's one electronic medical record that connects all of the information. So if you see us in Abu Dhabi, or you see us in Cleveland, or you see us in Florida, and soon, if you see us in London, all that information the same day is immediately accessible to all the providers and to you as a patient. It is my first time to be here. My impression is it's a wonderful, wonderful event. It's tremendous people. I love the fact that it's a lot of people communicating together, all focused on how we make things better for patients, how we improve patient outcomes. I've met a lot of really great people here. I think the majority of our operations are the same, and we have a consistent level of quality, safety, and experience of care that we provide across our entire system. And so we look to have that available at all locations. Pretty much the same. There'll be a little bit variations and maybe a couple little different focuses in some areas, but really one consistent product, all connected through one electronic medical record. Well, I think there's a lot of great technology. I think we all know that what needs to be done and what's coming is artificial intelligence. I think seeing some of the great innovative programs of artificial intelligence, which we are already used in our system at the Cleveland Clinic, but seeing some of these allows us to look at opportunities to work with industry and work with some others around the algorithms that can be developed. I think actually artificial intelligence offers a couple great opportunities in healthcare, which actually will decrease the cost of care as we go forward. Probably more important than artificial intelligence decreasing the cost of care is the fact that artificial intelligence can actually allow the doctor and the nurse to have more time with the patient. Because I think the core of what we do in healthcare, the core is the expression of empathy with a patient. And if we can restore time for that doctor and nurse interaction, then we can actually increase the empathy that's given and, equally important, received. A doctor and a nurse, their jobs that they have are about, the jobs that the doctor and nurse have are about collecting information, analyzing information, interpreting information, and then counseling. What artificial intelligence can do is it can greatly take away some of the burden of collection and analysis, and then allow more time for interpretation and especially counseling, because that's where the empathy comes in between a doctor and nurse. Yes, but always important is to improve the quality and safety, which will be allowed to be done. And as that's done, you will see the cost of care decreased. In the future, I'm really excited to see the incorporation of artificial intelligence, how we do that well, and again, how that will increase the quality and safety and experience of care while reducing the cost. But a critically important part of how we introduce artificial intelligence will be making sure that we have strong moral and ethical leadership to put artificial intelligence in place. Yes, actually we're very focused on collaborating with other organizations that share a culture that we share. And that's a culture that's concentrated on delivering improved patient outcomes. And so we look to collaborate with other healthcare providers, we look to collaborate with industry, we look to collaborate with research institutions, because that's how we'll get to a better answer for patient outcomes.